I qualified as a health visitor in 2007 and I initially got a job in Northampton, which I did for 5 years and thoroughly enjoyed it. But I just felt the need to experience practice in a different setting, and Luton seemed interesting. It's a good place to start work. You get a range of experiences and a range of opportunities for study days and trainings and just scope for practice.
I've found that I've been welcomed into a team, and although we do a lot of lone working, you never feel like you're here on your own. And I've known from spending time in other areas that actually the health visiting in Luton seems to be a real benefit, and it seems to be a lot better in this area from where I've visited elsewhere.
I came to Luton in 1986 to actually do my health visitor training and worked for 14 years as a health visitor in Luton before I went on to do the job I'm doing now. So I only had the two jobs, but it's been very satisfying. I've seen an enormous increase in the amount of health visitors, and it's actually quite nice having been here sort of 25 years ago, where we probably had the numbers that they've got now, and seen a decline in the number of health visitors. It's nice to know the numbers have picked back up, probably to where they were 20 years ago.
In the past, health visiting has been very ignored in a way, been quite depleted in our numbers, but things are very positive for the next 2 or 3 years with our numbers of health visitors that are coming up. So there'll be a lot more opportunity to work more closely with the Healthy Child programmes.
At the moment, we're putting forward for the big lottery funding, and hopefully if that is received, then from pregnancy up to 3 years of age, there'll be a big boost of funds available, which means that the services that are already in place will only be increased and make it easier to do our work, but also an enjoyable place to live.
Since I've been working here in Luton, I've become a practice teacher. I've had funding for myself to go and do the practice teacher course, which I completed last year. We have opportunities for team leads here in Luton, and we are having opportunities coming up in the next year. We've got family nurse partnership coming, so there's opportunities there to develop our role further as health visitors, working more individually with families.
There's people from every country, I think, represented in Luton, and so the opportunity it gives you in practice to just mix and understand people from different cultures and provide for them.
There's good network links to London, and we've got the airport as well, so really good communication facilities here. We have a very diverse population, which can have its challenges, but really helps you to grow and develop as a professional. There's a lot of investment going on in Luton, particularly with health visiting. We're increasing our numbers, so therefore we'll be able to support families out in the community a lot better.
A lot of the families really welcome you into their homes and want that help because they know that health visitors are not against them, they're there to support them.
I think it's a good place to work. The staff is friendly. You've got a lot of opportunities to attend study days and training days and update your practice. You get a lot of managerial support, and you just get the opportunity to practice in an environment where the experience you get is just so wide.